Good morning and good morning to you all. It is so lovely to see you. So we are just massage therapists. These are just our opinions, and we have a special guest today, Victoria Summits.
Voila.
Wonderful Victoria Summits. I think I figured out the Instagram thing, so I'm gonna hopefully be able to go live on Instagram in a minute. I'm hoping it out. I could be completely wrong. Who knows?
Before we get too into it, I'm going to put a disclaimer out there. My hiccups are ridiculous the last couple days.
Got it.
I have to stop talking about diaphragm release and actually go for one. So I apologize in advance for any obnoxious sounds that come from me.
They're not obnoxious. They've never been
They're
obnoxious.
so obnoxious, Chelsea. They're so.
They're not.
They're,
I know that you've lived with them, but I kind of love them. They are like, you know.
no, they're not. They're loud right now, and they fluctuate a little bit. They're like, so they are obnoxious. They are obnoxious. So I apologize in advance for being disruptive.
Okay, we are just disruptive in general, so Instagram works this time. Woo!
Yay!
Yay! It's really exciting. So if you are joining us on Instagram, I'll have to come back and forth to check and see if you're leaving us some comments, and we will 100% respond. If you are here on YouTube or Twitch, it'll show up right in our chat here, so that's fantastic. So feel free to, chat with us, talk with us, have some fun. But again, these are just our opinions. We are just massage therapists. And Cora, what is our topic today?
Treatment flow.
Treatment flow. I'm so excited. I see what you mean now. No. I actually really miss those. It's one of the things that I find extremely endearing about you. So the fact that I don't get to hear them literally every day. And every once in a while I get to hear them makes me happy. It may not make you happy, and I'm so sorry about that, but it totally makes me happy.
Well, that makes me happy.
All right. So treatment flow. What we mean by treatment flow is how we approach our treatments, if we have a sort of routine that we like to follow, and alterations that we make for, for our clients and whatnot. And who wants to go first? Obviously not Cora. I think she's now currently dealing with a child.
Ooh, that's fun. I don't miss those. I can.
Yeah, Vicky, you go first.
I guess I really don't I don't know. I think I only have a routine for the people who are pretty basic. If it's back, neck, shoulders, I'm pretty basic. I do it in quarters.
Ooh, okay.
Back. And so oftentimes I'll do the main flow for one side. I'll do my effleurage, that sort of thing, just to kind of warm up the area, warm up my hands because cold here.
No.
Yeah, scare a few clients when you touch them too. It's I try, I really do, but hot water just doesn't quite cut it sometimes. But I will usually do a main flow, and then once I start getting into it, usually within a couple of minutes, I'll start with the low back, and then I use thumb kneading and stuff to try and do the QLs and the erectors, and see if I can get in past the lats. Some people you can, some people you can't, and that's okay too. But and then I work. I go up into the shoulders, and then or the shoulder, and then I do I'll squeak in a little bit of that Terry's. Kind of scares people a little bit. So if it's a general massage, I do a general type treatment, and then I'll usually switch to the other side and then do the same thing on that side. And then I'll put the sheet up, and then I do the glutes with my elbow. and then I flip them over, and the last 15 minutes or so is the neck and jaw, if I can get in here and like into the jaw itself.
Actually, I've been doing that ever since you told me about that with the neck. Been getting underneath here.
Yeah. Yeah, one, it's easier for me. Like I used to be able to be that straight on person where they're looking straight up, you're going like this and you're digging, but that was hurting my forearms too much. So I decided like, and to take people out of the equation, because let's be honest, half the people will hold their head up. I turn their heads so that they are looking sideways, and then I can do all of the techniques without really hurting my forearms too much. I started doing that because for me, but also because I have quite a few clients who have issues with their neck. Like I have one guy that literally he does not like people touching his neck. He will let me do it. I save only 10 minutes for him because I know it's excruciating for him. He needs it. He knows he does. But if he's looking straight up, he's tense. He can't relax. So I turn it to take it out of like that extension. So he doesn't know how to hold up his head sideways. So he kind of relaxes, right? It just works. Like it works much better.
That's really cool.
Yeah. But like if I've got somebody who comes in with a specific type of condition and stuff, no, I don't have a routine. Only if it's a basic back, neck, shoulders. And if they want a full body, and if they want like a full body relax, I'll do back for a half an hour. I always spend more time on the back. And then I'll do like glutes, and then I save about 15 minutes for the legs and then 15 minutes for the neck.
All right. That's a really interesting flow. I like it. So you always start them face down? Yes,
always. First of all, like I said the last time, I don't like to see their face when they're in there. Like not until we get to the neck. But then I'm not even looking at them. I'm looking at the wall, I'm looking at the ceiling, whatever. It's awkward for me. So I have a couple clients who will literally like roll their eyes up into their head to look at me in the face. And I'm like, whoa, that is too much intimacy. Like, can't do it. Nope, don't do that. Just the word out there for people who get massages. Please don't look at your therapist.
I don't care, actually. I don't really mind. Oh, yeah, it doesn't bother me at all. You're freaking. I know that you have ADHD, but I also think, honestly, that you have a little bit of autism. Yeah, 100%. With some of the things you tell me, oh my gosh, yeah.
Well, and it's funny because like I've curated my clientele. Like, I mean, I've seen lots of like posts from massage therapists where they comment about, you know, talking during massage or this or that or whatever. Now, like, I don't care. If my client wants to talk, they can talk. If they don't want to talk, they don't have to talk. I don't care. I like when someone walks in and says, you know what, like they're usually a talker and they're like, hey, you know what, I'm having a day. I just need to chill. Cool. Cool. It's awesome. I like knowing what I'm going into, I guess, if that makes any sense. So like, I like when my client is very forthright about everything, because then I can be like, okay, not a problem. And that means like from what you expect in the massage to like what depth you want to everything, because like I don't want it to be a surprise. I don't like that. It's not good for them, it's not good for us, right? And I think there are a few people that I will usually feel very awkward with. And that's usually like when you walk in and be like, okay, so like, what am I helping you with today? And they're like, massage. And I'm like, no, I thought you were here for chiro. Like, I mean, chiro's over there. Like, I don't know. And then they look at you for like a few minutes going like, And it's like, man, of course I know you want a massage. Okay, like, my God. Yeah, I try not to be like that person, but I sometimes am. I can
You
laugh it
can't
off,
hide.
and
You
I
can't hide your
can't.
face.
I can't. So, like, if people, I think the one big frustrating thing, and maybe we can talk about this in future, whatever, but is like when people do not know their body, do not know what's happening to their body, and don't care.
Yeah.
I feel like in that situation, though, I think that's where awareness comes in. And I think massage can really help with that awareness by
Why?
bringing attention to what you're doing and what they're feeling, and
Mhm.
then explaining what's actually happening, what you're feeling.
Yeah,
And
but
then,
there's still a certain amount of people that just don't care. They don't care. They don't want to know. They come in, they do their massage, that makes them feel better for however long it makes them feel better, and then they're out the door.
well, those people tend to identify with their pain, though. That's who they are.
Yeah.
Like
Yeah. They don't want their pain to be gone.
yeah, they don't, because that's who they are. That's what they know. That's how they live,
Mhm.
and that's
Yeah.
their shield.
That's such a simple way to live. I wish.
It's one of
Really
those
wish.
things where, like, I have a client like that too, and it's constant. She's going through all the different things that they can do, but never getting better. And then she'll throw something out there like, "Oh, I'm actually standing straighter." And it's like, "Yeah, you are standing straighter." And she's like, "Oh, but then I had to do this, this, and this, and now it just really hurts." But she's not open to like exploring other aspects. She just wants the pain treated.
Yeah.
It's like, well, I've tried to explain to her like the balance of the pelvis and how like everything else rolls with it and affects it. And
Mhm.
she finally let me treat the IT band. And she actually was like, wow. So I think that for us, I think that was kind of the breaking point or that opening that we needed in order to actually facilitate her healing. But I think that there's a lot of people like that, whether it's like, I know people tell me it's like they want attention. I don't necessarily know if that's real. I just think, and maybe it is to a point, but I honestly think it's just, this is who I am. This is what it is. And that's where I think diagnoses are a bittersweet situation,
Mm-hmm.
because all of a sudden I am fibromyalgia.
Not
I
I
am
have.
COPD. Not this is part of me. This is who I am. And because
Yeah.
of this, I can't do X, Y, and Z. And I never will be.
That's a big one for me. Like a big one. Like when I go through my conversations like with my clients, like in the treatment, after the treatment, whatever. And we discuss like, let's say the big one. Oh, it's old age. I'm just getting older. The what? The what? Like your muscles regenerate. Like the only thing that it changes over time, like the things that's awesome. The thing that changes over time is like your mineral deficiencies and stuff like that. So like if you can manage to exercise to get your minerals, proper nutrition, um is your body going to change? Yeah. Yes, it is. Like that's just what happens. But
Mhm.
the fact that you sit there and like you hear your clients go and they're 40, like I'm 48. Okay. They're 40 and they're like, oh, like it's just old age. That's just what happens.
I'm like,
No,
no.
no, that's
That's where
for
education
for
comes in, though, right?
anybody that's listening, when she says that muscles regenerate, she doesn't mean that they duplicate themselves. It means that
mm-mm.
they can go through a healing process, a
Yeah.
small healing process, as long as they're not literally dead.
Yeah. Well, and that's kind of it. Like as long as you don't have muscle wasting, like even muscle atrophy can rebuild.
Mm-mm.
Um,
It depends on how far back it's gone.
well, and that's the thing, and how long it's been there, right?
Yeah.
And like what caused it. Like I have, we won't get into that because like, yeah, we could talk about that all day. But like,
Yeah.
yes, routines.
We need Cora a chance to chat through her flow.
Mhm.
Uh, but yes, it wouldn't be a just massage therapist podcast episode without us going off into 3 different tangents.
Oh yeah.
So Cora, what about your flow? What does your flow kind of look like?
Well, my full body flow is actually very similar to Vicky's. Like especially if it's the glutes being treated, I will spend that half hour on the back and the glutes. And then the rest of the time will just be kind of distributed. Just because I'm a firm believer in the pelvis first.
Mhm.
So that's usually what I try to address if the client's open to it. But as far as the back, I would say that's where I have the most consistent flow. And I'll always kind of start with some fascial spreading just to kind of assess where the restrictions are. And then I'll come into my cross hand along the spine just to see where the spinal segments are stuck. And then from there, I'll come into the SI, and that's where I really assess that SI joint, because I find that that's usually a key factor in low back pain is that SI joint. So I'll come in and then I'll kind of do some cross hand over the posterior ilium along that SI. I'll usually incorporate some mobilizations to the SI, and then I'll come into that iliolumbar ligament. And then I get my lotion.
Iliolumbar ligament. That thing is so. Oh my god. Okay, sorry. Tangent. I had a client the other day on her left side. Her right side felt normal, like except at the left side, the iliolumbar ligament was actually way overstretched, and there was a palpable gap.
Oh.
I was like, oh my gosh. So she's working with Kyra right now to bring it back. And I'm
Mhm.
working on the musculature to try and like make sure it stays back because
That's
it was
tough.
like my thumb fit in the gap.
That's fun. Not for
Anyway,
her.
sorry.
That's fun.
No.
Not really.
Sorry. Tangent done. Keep going.
But yeah, then I'll get the lotion, and then I'll usually really target like the erector spinae and the lats first, and then I'll work my way up to the shoulder girdle. So yeah, I don't know.
Yeah.
And then and then I'll just kind of incorporate the neck and the glutes all as just like one massive
Yeah.
I'll just treat it all as one. Really making sure I come into like subscap almost always. I always come into subscap. I always go into the teres, and that's something that clients are really like, oh, nobody ever does that.
Mm-mm. I get that a lot. And like, I find that the new therapists, like, and I get it, because I mean, when I was a new therapist, I wasn't comfortable either. There was certain techniques that I just didn't use as like a new therapist because I was too uncomfortable. One, I was uncomfortable with having to explain it to the client. Like, that's my own thing to deal with. But also I wasn't sure what the client would say if I said, oh, hey, by the way, we're going to have to do this, this, and this. I assumed that they would be okay with it, but like, I didn't know what I would do if they weren't. So I was like, really hard to have that conversation when I first started. Now it's like, when I go for the psoas and stuff, I'm like, okay, so I'm pretty sure this is the problem. Like, this is what I have to do. And I explain it all to them, and I'm like, it's going to be uncomfortable. And they're just like, okay, let's do this. And I'm
I did
like,
that one yesterday.
I love the psoas. Treating the psoas is one of my favorites.
Second time this girl has ever come to me in 3 months, and I was like, maybe we should do this, and she's like,
Well, and I think that a lot of people, like, especially for low back pain, everybody thinks it's in the back. It's not. Half the time it's not. Like, if it's a like a disc issue or something like that, most definitely. But like, if it's muscular, oftentimes it's in the hips.
mm-hmm.
Like, and more often than not, it's the psoas, right? So it's like, especially if they do sitting jobs, a lot of sitting jobs, like, people shorten those psoas. So it's like, okay. So like, I've had a couple of clients like in their 50s come see me, and it'll be like their first time, and I don't want to like scare them off. Like, it's kind of one of those things. I'll do a pretty basic massage for them because it's your first time. Like, I don't want to like terrorize you here. Like, sorry. And then in the second one, I'll be like, okay, so we're gonna treat, and I often do that because first massages, especially if it's their very first massage, or even their first massage with me, I do have a very basic routine. And I probably only use like medium to firm pressure. Like I'll lighten up.
Oh yeah, for those of you who don't know, Vicky is the deepest pressure. It's just the deepest ever pressure right there.
Yeah.
Oh man.
I have right currently, I have about 5 clients. I think it's about 5 regular clients that require extra deep.
Oh, I couldn't do
Like
that.
I literally put my body through the ringer. I cannot have them on the same day. They have to be spread out. Thankfully they are. And they're not like completely regular, like they don't come in like every 3 weeks or whatever, but when they do come in, they fully expect to walk out feeling bruised.
Ugh, bleh, nope.
It's not for everyone. Like it really isn't for everyone. And like those are the type of people where like, and I almost find, I don't know about anybody else, but I find like deep tissue, it takes longer for certain body parts, right? Like if I'm going to be working like deep tissue and like you have like a specific concern, most often than not, either one, it's an SI joint issue or shoulders. It's usually the 2 big ones that I have to deal with. I could spend the whole time on that area because I'm working each individual muscle as I go through. I'm working trigger points, adhesions. So like I said, like if I do a basic massage, yes, there's a routine. But if I'm doing that, there's a bit more of a routine, I suppose, if I'm working like one area. I will go for certain muscles that I know are a problem. Like if I'm doing an SI joint, I'm working the low back. I want to loosen everything up. I want to loosen those lats up. I want to loosen up the hamstrings. So I'll go for the attachments on the hamstrings, loosen up that area. And then I dive in. And when I go in, like I do actually work over the sheet. I know some people don't. I don't find any extra benefit pulling the sheet down and using it for deep muscle stripping. I don't find any extra benefit for that. Some people do. It's just not my thing. Because I'm using my elbow to strip the inner muscles, or I'm using my knuckles. Oh, trust me, it's not pleasant. But when I go in there, like I'm literally scouring in there, like getting into that joint, like right into that SI joint. And, yeah, and like I'm working all of the little tendons, all the little ligaments. I'm working around the tailbone. I'm working the piriformis. I'm working those small little teeny tiny little muscles in there. I work them all. And it takes so much time. Like you literally do not have any time for the rest of the back. I don't know. Like, I think I go in specifically, like if I start SI joint, like on the hip part after like I do a general massage, like I go in for the glute med. I start with the glute med and I work myself from the top of that hip joint and I work down.
Cool.
Yeah. I don't know. OCD?
Cora,
I think I'm OCD.
Cora, you're muted. Did you know you're muted?
I do, yeah.
Oh, okay. I was like, I wonder if she knows she's muted. That's a pretty good segue to. This is quite fun. You two both start all of your clients face down.
Yes.
I'm
do it
the
differently.
opposite. Yeah, I always start my clients face up. Unless I'm going to start from the base up, I'd rather start from the head and neck and go down. Some people, their legs are and their hips are more the issue, so I'll start feet and go up, in which case I'll start them face down. But no, my clients, I always start face up, and I do neck, and I have a very, very particular, unlike the two of you, I have a very particular routine that that I follow. Granted, as we find things for therapeutic and for the deep tissue, my routine will break and we'll focus on what we need to focus on. But no, I have a very specific routine. The neck is always, after warming it up with effleurage, one side, then the other side. And it always starts with SCM. I always do SCM. And that's my whole thing is I follow muscle groups and individual muscles from top
Mhm.
layer all the way through, which I know you guys do top layer all the way through. That's always the same. But
Yep.
I always am checking the muscles from a specific routine.
Mm.
The neck, it's SCM, pec major and minor, around the shoulder up to the subox and the attachments for all the neck extensors, through the neck extensors and the upper traps, bulk of the upper trap, and then the lateral muscles.
See, I break up the neck in quarters as well.
Yeah, I do just muscle by muscle. I don't break anything up into anything. I do muscle by
Mhm.
muscle, and I check every single muscle.
Yeah, that's fair.
It's quite fun, and I, unlike you guys, I treat the arms almost every treatment.
I don't.
Yeah.
I do
I don't.
almost
I
every.
don't unless they ask.
It's like I do the left side of the neck, and then I do the left arm. I do the right side of the neck, then I do the right arm. If I honestly, what I would love to do is left side of the neck, left arm, left leg, right side of the neck, right arm, right leg, and
Yeah.
go flow down between the two of them, and then flip them and do the same thing. But I haven't been brave enough to try it on
See,
anybody.
for me, the neck is usually especially when treating the feet. The feet are the last things I treat.
Yeah.
Which is one of the reasons why I start face up, because it's easier. I love treating the feet when they're face down. So I'll start face up, get all of the chattiness out of the way at the beginning of the treatment. Now, some of my clients are chatty the whole way through, and some of them don't talk after the first 5 minutes, right? But there are some that like to do some chatty at the beginning, gets rid of any nervous energy that they might have, and just
Yeah.
expels any of that excess that they have. And then by the time I get to the front of their legs, because I also always do the front of the legs, unless it's a deep tissue, but my therapeutic and my Swedish, my relaxation treatments, I always do the front of the legs. I always get the adductors. All of that to me, like the adductors are just as important to me as the iliopsoas are to you, as the SI joint is to you.
Mm-hmm.
Right? Like the adductors pull the pelvis out of whack just as often. So I'm always doing that. And by the time I get to the anterior leg, they're starting to wind down and relax. And then the second half of the treatment, they're face down and they can just sleep. They don't have to worry about any excessive energy, any like nervous energy that they might have, or their emotions have started to calm and they're fully into the parasympathetic nervous system state at that point. They're flipped and they just drift off while I work on their back and their legs. And even with the back, hold on, I want to do my.
Go ahead.
The back, I also go a specific muscle group by specific muscle group. I start with the upper traps, the entire traps. Start with the entire traps, and then the sits muscles, and then the teres major specifically into the attachment of lats, which then brings me to the lower back. But before I get into the lower back, I do the rib raking. And I do rib raking, by the way, on every client. I love my rib.
I can't do that for every client.
Oh, well, some of them are ticklers, so I can't. But
Yeah.
the rib raking, and then go down lats, and then dig deeper in from there. So I literally am just checking every muscle. One of my favorite ones to do is while I'm doing the lats before I move on, I get the serratus anterior.
That's a rough one. Yeah.
Oh, I love it. The attachment to the scapula, to the inferior angle there.
See, and when I treat serratus, and I treat serratus almost every time I do the back, I get so many people that are like,
Nobody's ever touched there.
Nobody touches there. No one does the sides, and like, I'm like, what? Like you could even treat the whole back without even going down the side. You can still get all of those little attachments. Like I'm like, what?
Yeah, it's kind of.
I'm old school though, like 20 years, man. Like,
yeah, and I think that a lot of. Oh, sorry, Cora, go ahead.
That's okay.
Oh, I thought you unmuted to say something.
That's okay. You finish what you were saying first.
No, I don't remember what I was going to say. You got it.
Serratus isn't one that I usually target, which is weird. But like I address it, but it's not like, oh, I'm going to come into serratus unless there's really that prominent protraction. And then I'll come to the serratus. But I guess you can't really treat subscap without serratus. So
Yeah, it's almost impossible.
I do get in there, it's not a conscious decision, I guess.
Yeah, like it's more of a like an addition. Like for me, like it's never, unless someone's specifically having certain issues, like you said, Cora, like it's not some muscle that I would spend a couple of minutes on. Like I usually just I check the edges, I check everything to make sure it's functioning okay, and like we're not looking at adhesions and trigger points. Might treat a trigger point.
Well, I get into that tendon. That tendon just, it needs the love. I don't know if you guys have noticed this, but have you noticed that on the non-dominant hand side, that tendon is always so much thicker?
Mm-hmm.
Have you noticed that? Oh my gosh, it's so cool.
It's because of that isometric contraction, right?
They hold with their non-dominant side.
Yeah.
So that tendon just gets so much thicker. Oh, it's so much fun to treat. I'm a little bit obsessed with the serratus anterior, though, because when I was in school, my first year, I found a trigger point in my serratus anterior on the left side. And I was like, what muscle is this, to the teaching assistant that was there? And she couldn't tell me. So I kind of obsessed over what this was for the while. So, it's just one of those muscles that stuck.
Mm-hmm. Yeah.
One of my favorite places, once I'm finished doing the whole neck, arms, legs, back, and of course with back into the glutes and with legs into the glutes, one of my favorite places to get to is the calves.
I love working on calves.
Oh God, they are so much fun to work on. And again, muscle group by muscle group. So because I do the front first, I get most of the quads, and then when we flip, I get through the hams and can get to the attachments of the quads underneath. So yeah, I love giving people that feeling of I'm walking on a cloud when they leave.
Yeah.
Oh yeah.
I like when people allow me to do legs, like for calves and stuff, because like I don't think people like you wouldn't necessarily have the same amount of pain in your legs that you do like your upper body. It does not, however, mean that your legs are not tight. And so I always, like, for my clients that always are back, neck, shoulders all the time, I always tell them, okay, so like one of these days we're going to take one of these appointments and we're just going to work hips to feet.
Yep.
And they're just like, what? And I'm like, I will always work lighter when I do feet, like when I do the lower legs, because one, they're way more sensitive, way more sensitive. But I will still do like all of the attachments. I will do adhesions and trigger points and like things that I find in there. And then they're like, holy, like what is going on? I'm like, dude, like this is what happens over time. You just don't necessarily feel it at the time because your back hurts so much.
Yeah. Or you may not feel it here because it's affecting here, it's affecting your lower back, or it's affecting your hips, and that's where you're feeling it.
100%, especially for hamstring.
Oh, I do enjoy treating the hammies.
I do too. It's one that actually is pretty dramatic. That's why I like it, because like they're postural muscles, right? They're not like huge prime movers. Like yes, they move, but they're not huge prime movers. So like they're stabilizing the low back and the hip joint. So it's like you kind of.
I feel the same way about the adductors.
Well, adductors to me, okay, so like when you're talking about like the front of the leg and stuff, like I don't always treat the front of the leg. And if someone just wants like a basic, unless they want something specific, I will treat the front of the leg. But for the vast majority, a lot of my clients usually just want the posterior. They just want the posterior leg. So I do treat the adductors from the posterior. I got really good at treating most of the muscles except for the actual full quad, like rectus, if I'm doing the back, that's probably the only one that I don't get to. But I
Yeah.
can get the full leg from the back.
And intermedius.
Well, yeah, like that one's a little bit more trickier, but
And sartorius.
unless they really have like a specific issue, like if they have a rotation issue or whatever, then I might flip them over and I'll do the quad 4 and then I'll strip in the adductors and stuff. That's one that I usually really warn them about because it hurts.
You just go lighter, dude.
You can go lighter, yes, but it still hurts. They're like
your lighter is not lighter.
I use my thumb. I don't even use knuckles at that point. I'm just using my thumb. Like, yeah, like I go lighter, and yeah, you probably just go. I don't.
Oh,
I'm like,
oh, shots fired. This is bad.
Yeah, I think that's why like I don't do certain muscle groups, and it's just because like I am a deeper therapist, so it's like if I'm going to do something like that, it's gonna have to have like almost like a separate discussion either during the massage, like if they say, hey, like I'm having problems with this, I'd be like, okay, cool. So when I go to start it, like if I say, okay, like we're gonna do the adductors, this is what I'm gonna do, it's going to be very uncomfortable, but I want you to talk me through this. I want you to tell me whether or not it's too much. Like I need clear communication on those things because I don't want to hurt them for one. It's going to be uncomfortable and I would rather like more of a burn pain than like, oh my God, right? So I'm usually like, yeah, and I only use my thumb. Like I just strip through it. Like I try to go in as gentle as I can. Sometimes you have to push a little bit and it's going to be very uncomfortable.
I use my fingers, my fingertips and my knuckles every time, but I modulate how deep I'm going with.
See, I assume if I'm going to use my knuckles, I'm going right in, right? So I don't use knuckles for that reason.
And by the way, anyone who is listening to this, both approaches are good.
Yeah,
yeah. Like neither one of those approaches are wrong.
Yeah,
it just really depends on you.
There is just some therapists like me who cannot modulate pressure when you use certain body parts. So like I can, if I use my elbow, I can ease in. I can.
I can't. If I use my elbow, I'm all in.
Yeah. And see, that's like, the way I am with knuckles, because I've got it like out and like I'm like,
yeah,
like that's the way I look at knuckles. But like, yeah, like I can't regulate with my knuckles, but like with my elbow, like I'll lean to the side and I just kind of skim and I test it out a couple of times first to see if they're flinching, see how they're reacting to it, and then I kind of start steadily getting a little more pressure. And
I
then
do that with my knuckles, and when it's to the point where I can add my elbow, then I add my elbow. That's so funny.
Yeah. And I think that actually goes back to like when we were in school, like Jeff, when we were going through trigger points, I couldn't find trigger points, right? Like I couldn't find them. I didn't know what they felt like. Like in my mind's eye, I have to visualize it. Like that's the TISM. I have to visualize it. So like I have to see it in my head what that looks like. Like I could bypass it 100 times, but the second that I found a trigger point, I never forgot it. It was like instant. I can find them anywhere in the body. Because once I actually found it, felt it, and like could visualize it in my brain, got it. So I treat a lot of trigger points, like a lot.
Yeah. I love treating trigger points. They're fun.
Me too.
Well, I feel like that whole, like, you don't know what you don't know, right? So you don't know what you're feeling
100%.
for. And that goes with all the textures, adhesions, fibrosis, like all of that. You don't know what you don't know. And once you do know, then it's like, aha, light bulb.
Yep. And like even with my elbow, I can find trigger points with my elbow far easier than I can find them with my thumb sometimes. It's like I'll be going over and that's why I test it. Like I go like light layers first and then I'll go in a little deeper and then I'll start hitching and then I'll be like, oh, there it is. And then I'll just like, yeah. It also helps me with that technique of getting deeper and deeper and deeper. It helps me with that one. So that's why oftentimes you'll find me doing ulnar and elbow.
I do my knuckles for that.
I see, it's all I use is my elbow.
I can't. Like, that's when, like, I use my knuckles on, like, shoulders, glutes, just get in there. Like,
Use my knuckles on everything.
Yeah. See, if I use my knuckles, like, I guess I can use, sometimes I will, but for the most part, like, I find when I really get into something, I kind of forget about my wrist. And then, but I find, like, with my elbow, I'm kind of like, okay, here we are. And I'm so worried about I'm so worried about going over something I'm not supposed to, that I'm very more aware when I am using my elbow. Whereas with my knuckle, I'm like, ooh, and just like I tend to lose awareness of my pressure when I am using, actually, either way, if I start talking, I start to lose awareness of my pressure. Because
I don't.
So, or if it's fun, if I'm like, oh, this needs it, then I just kind of lose myself. And I'm like, okay, here we go. We're going to do this. We're going to do some art. And then we like do some active releases. And then they're like, is my pressure okay though? And they're like, uh-huh. Okay. Don't let me take you over a 6.
Right?
Yeah, always telling people in my therapeutic treatments, not over a 5. In my deep tissue, not over a 7. Like, I'm super picky with them.
I've had a few clients, and this kind of frustrates me a little bit. I think this is a big frustration for me in the massaging world, but like, I am deep tissue, okay? But even then, I don't want you feeling pain for 3-4 days. I don't want you leaving here in so much pain. Like, what? Like, I think I've had so many clients come in and they're just like, oh yeah, like, I know it's going to hurt. And I'm like, yes, but no. Like, I'm not looking to trigger your nerves here. Like, we're not, like, I think that there are some therapists that just don't understand that deep tissue oftentimes doesn't have to mean deep. It means you're specific. And
I agree.
People will just take their elbow, gnaw right in there, and just strip the whole muscle. And they're just like, if your body has to go into a
fight or
reflex
flight
mode, right? That's too much. Like, I have often told my clients, like, no, like, one day, I always say, like, 24 hours, don't judge me, because you're going to feel bruised the next day. Yes. Some people do, some people don't. Depends on the person. However, if after 24 hours, you need to let me know this, because like the next time you come in, because that was too much pressure.
Agreed. Fully agree with you.
Yeah, like it's a big, huge frustration for me, because I am a deep therapist. And so when people often think of, oh my God, like, she's deep. Yeah, okay, cool. I can. Don't kid yourself. I can. But the choice is that I don't always. Like, I have certain people who have a very high pain tolerance, and that's cool. I have certain people who are at a medium tolerance, and that is okay too. We're still going to go specific. We're still going to dig in there, but we're going to do it in a more gentler way. Like, there is that option.
So important. It's so important, especially if you are a deeper therapist, to know that you can't be causing super long-lasting pain. That's not why they're coming to you. They're coming to you for something to get, quote unquote, fixed. Of course, we don't fix it. We help the body actually heal an area, but we shouldn't be causing pain for more than 24 hours after. That soreness should just be like a DOMS. It should just be a brief DOMS type of soreness. Sorry, delayed onset muscle soreness, for those of you watching who don't know.
It should feel like you went to the gym.
Yeah, that's it.
You got that ache. Like, when you go to move in a certain way, you're like, ooh, okay. That should be how it should be for about 24 hours. Like I said,
Listen,
like,
if you can.
Usually it's when you wake up in the next morning. By like noon, you're already feeling better, right? Like, that should be, the more you move, the more it's going to flush itself out, right? But like, I always tell people, don't judge me for 24 hours. Don't judge me. But like, because some people will. And then I have some people who are like, oh, I felt nothing. Like, I felt great after. And I felt great the next day. I'm like, Both.
Oh yeah, I had a client the other day who came in. She's like, "It's been over a year since I've been to a massage because the last massage therapist literally gave me bruises. Like,
Right?
the whole upper back was fully bruised because they went so hard." And I'm like, "Ugh, that is not what I
Yeah.
needed."
I think that people misinterpret what deep means.
Yeah.
Yes, it does mean sometimes that you're digging in there, but it's like you don't go all in all at once. You
No, you
ease
shouldn't
in,
ever.
right? If you can't get past the second layer, you don't need to be at the bottom. Like, you need to get past that second layer to get
Yeah.
down. So oftentimes, like, I'll tell people, like, dude, like, I got some of this stuff out. I worked some trigger points, which are going to be a little sore the next day, but we did not get to where I wanted to be. So we're going to have to reassess this. Sometimes it's going to have to take a couple of treatments to get it.
Mhm.
And that's okay. But, like, I don't know.
Why
It's a
couldn't you
huge
get down there on the
frustration.
first one? Well, because it's not safe.
I'm not looking to cause you whiplash. Like, like, I don't know. Like, I just like people. I understand my clients don't understand this, but massage therapists should.
Massage therapist should. Yeah. Sorry, I'm
And like,
super
I
full.
always educate my clients when they come in. They'll be like, "Yeah, like I had this massage, and like this person like really hurt me, and I was kind of not thinking about coming back." Like, that scares people. Like, first of all, if it's their first time coming, firm
nice.
pressure only. Firm pressure. Be nice to them. Don't go whoosh, right. Like,
If it's a client's first
I
time, the girls at the
yeah.
the front desk, they know not to book a
Yeah.
first time ever massage. Not just like with me, if they've had massage before, fine, but nothing more than therapeutic if it's their very first ever
Mhm.
massage.
Yep. I've had a couple of people put notes on clients' profiles saying they want deep in big letters. And I'm like, okay. I still, when they come in, I'm still like, okay. So what are your expectations?
Mhm.
And what are you wanting me to do? Let's be specific, because if you're saying deep, I want to know what your interpretation is.
Mhm.
That's what I want to know, because there is a lot of misconception between the communication between one person and another. Like, I wish people were more open with communication and not worried about offending people all the time. Like, just be straightforward. Like, if
One of
this
the
is
things that
your,
I say, I'm sorry, I'm just gonna cut
yeah,
you. One of the things that I say to them
yeah,
is, if you don't like something that I do, please just tell me. I don't get offended by anything anymore. Like,
no.
literally, those are the words I use.
Yeah, I
And
do
if your
too. Very
therapist is
adaptable.
getting offended, that's not the right one for you.
Yeah, no.
And that's okay. That is okay. Like, I mean, I've worked with a lot of different therapists. I had one girl that did not want to work on children. She didn't want to work on pregnant women. She was kind of rude about it. But it is her preference. If she chooses not to do it, you can put that in her file. Like, I don't want to do this. Cool. We'll book you somebody else. That is okay, right? But it's just like, not every therapist is going to be 100% for everyone. I learned early on when I started massage that I was not for everyone. I have often told my clients when they come in and they'll tell me what kind of massage they want, I'm like, I'm not for you. I can recommend you someone, but I am not for you.
Yeah.
And I am okay with that. It doesn't hurt my feelings. It's fine.
Mhm.
Like, I think when people get triggered about that kind of stuff, and I use that word trigger because it does kind of instigate an emotional response to people, that when a client tells you, hey, like, I really didn't like this, blah, blah, blah. And they go, oh, what? And it's like,
Really? They didn't like it.
uh,
They're allowed to not like something.
they're paying for the service. So, like, within limits, like, it's their treatment.
I am going to have
So,
to get us cut off pretty quickly here because I still have to get ready to go to work. Cora, did you have anything extra that you
me
wanted
too.
to add to the stream before we shut off today?
No, it's all good. It's all good.
All right. All right. Well, wonderful. I'm not even dressed for work yet. I'm dressed for this.
I'm totally ready for work already.
Ugh, slightly jealous. Granted, your work today is 2 blocks.
Yep.
Mine is 45 minutes. So yeah, this is fun. We just came up with 80 more topics again to bring up in future
Right?
podcasts. 'cause we can't
There's
help it.
so much. There's so
much
much.
that we can talk about. But thank you so much for joining us. Those of you who have joined us for the live, thank you so much. For those of you who are watching this later on, we always look forward to hearing from you and seeing your views as per always. There's going to come up on the screen here a couple of things. There's going to be a video that YouTube thinks you're going to like. And there's also going to be a link to our channel on here if you want to come and see us. I will put the captions on here if you want to see any of us on our social media platforms. Victoria's social media platform is the RMT Adventures there. And then, of course, there's CNC, Cora's, and then mine is the Just Massage Therapist. If you want to come and see us ever, or chat with us, we'd love to hear from you. Yeah. Otherwise, this has been absolutely lovely. Thank you so much, Vicky, for joining us again.
Yes,
Thank you for inviting me.
Yay! And Cora, I'll see you on Monday. Monday. If you guys are wondering, we're having our first February meeting on Monday, which means that we might have a schedule coming for you soon.
Cool.
Okay. All right. See y'all another day.